Well, hello everyone, and welcome to our one-on-one discussions with the scientists within the Mind Project to Cure Paralysis. My name is Dalton Dietrich, and today I have the pleasure of speaking with Dr. Gillian Hotz, who's a professor in the Department of Neurological Surgery and a very important member of the Mind Project research and clinical programs. Hi, Gillian. How you doing?
I'm great, Dalton. How are you doing?
I'm good. I'm good. Great to see you. The Mind Project is very interested in treating brain and spinal cord injury, state-of-the-art approaches in terms of recovery of function and things like that. But your programs are really concentrating, in addition to targeting injury, protection, protecting people, actually preventing injuries. And that's through your KiDZ Neuroscience Center. So Gillian, can you tell us a little bit about that and what you're doing with the kids throughout South Florida?
That's great. Thanks for the question. The KiDZ Neuroscience Center focuses on decreasing brain and spinal cord injury in children and adolescents. We've been in the community for, I guess, the last almost 20 years. And we've really been able to have partnerships with all our community leaders and many stakeholders, which makes the program successful because, you know, it could start at the medical center, which it does, but we absolutely need our schools, our engineers, our police, and many other partners to get the work done.
But it's so right that so many people, I mean, we read about concussion. Obviously, the first time we think about it is sports, athletics, but young people playing football, playing soccer, riding bikes, skateboarding, things of this nature, you see them doing also having concussions, which is a real major problem, especially when you're very young, when you're in the developmental age of your brain and spinal cord.
You're right, and it's a spectrum. You know, we see kids, unfortunately, that come into our trauma center with very severe brain injuries. And with the developing brain, yes, they have neuroplasticity on their side, but depending on the age, when that really bad injury happens, that could really cause lifelong issues and sequelae down the road in academics and, as you said, in physical skills. So what we like to try and do is a lot of early intervention, and we really focus now our energies on teaching these young children safe ways to do things, whether it's in a WalkSafe program based in our elementary schools, it's a BikeSafe program based in our middle schools, and then we've got the skateboard program, which is throughout the skate parks in the county. We've also been able to go county-wide. We've got programs also statewide. So I think you're right, 100%. It starts with prevention, education, and these are lifelong lessons that we want children to take throughout their life.
And you and your team are going to high schools, elementary schools throughout Florida and actually giving lectures and answering questions and talking about, you know, even crossing the street, how you should be looking and being safe and things of this nature.
Correct. And social media today, as you said, you know, look at where we are now with the coronavirus. Most of us are at home looking, you know, in the computer most of the day, doing these meetings, PSAs, Instagram, tweeting, Facebook. So there's a lot of opportunity now with technology to get our message out. You don't really have to continue to go to all these in-person outreach events, which we do a lot of, because I still think hands-on training is very important to demo to young children. We work in the schools, we work in the parks. So, there's a lot going on and a lot to do.
Yeah, as I've talked to the faculty during the pandemic, I've always asked them, how is this affecting your research? How is this affecting your education and outreach programs? And it's clear now that we're learning new tools that we can use that are actually going to benefit us after the pandemic is gone.
Absolutely. We're in classrooms, so we've asked teachers now to take our PSA materials, our flyers, our scope of work curriculum that they learn in the classroom and add it to some of these interactive classrooms for the elementary school kids and for the middle school kids. So we've given them materials to do that. I think, it's actually, the way that the future is probably going to be. And now we're finding out, and we're demoing and piloting this now. So I think, we're going to see a lot more of this in the near future.
Great. Now, in addition to your outreach programs, you're also very active in clinical trials, and you're the University of Miami representative PI of the TRACK TBI program, which is an NIH-funded multi-center trial that's targeting different severities of traumatic brain injury. Can you tell us a little bit about that and what the purpose of this large multi-center trial is?
Absolutely. Because we have such huge numbers of brain injury here from our level 1 all the way to our sports concussion programs, this is a program that's got about 22 sites now, federally funded. Jeff Manley is the lead PI out of UCSF, and he's got many, partners. And for example, we've been one of the original sites for the last 6 years, looking at really the chronological outcome and recovery of people with brain injury of all severities, all ages. We were one of the pediatric sites. So looking at everything from the site of the injury to the resuscitation efforts, to going back to school, going back to work, MRIs, also blood samples sent to a lab to analyze the blood samples at certain periods of recovery, and CT scan analysis. It's quite comprehensive. And now we've got another add-on, which is going to be funded by Abbott, to look at another technique of looking at a blood sample with an iStat device. So we're just going to be starting that as well. But this is, 6-7 years. We're following patients up long-term now, following them 2-3 years post-injury, surveys over the phone, which we're doing now, to give us a lot of information of long-term recovery.
Yeah, this trial is so important because TBI is such a heterogeneous problem. Every patient is a little bit different. There are variety of pathologies, a variety spectrum of behavioral cognitive problems. And so this large data set is going to tell us about this spectrum as you described with TBI. And that's going to help us hopefully be more selective when we go to clinical trials targeting a particular pathomechanism or injury cascade. And hopefully that will help us successfully translate our preclinical studies into the clinic and make a difference in people's lives.
Absolutely. And it's all about, as you said, sort of following these people, tracking them, which is challenging because you want to see how these people do 2, 3, 4 years, post their injury. And we have that opportunity with our concussion program for sports because we've got a contract with the school board, which allows us to track every county-wide sports-related concussion here and now in also Palm Beach County. So we've got 35 public high schools here, 26 in Palm Beach that are public, and we're able to really track and follow these concussion cases in clinic throughout their sports, return to play, return to learn, which is really gives us a really good picture into how do we prevent some of these things and how do we get better at management.
Right. So in addition to all of these activities, you're also very interested in testing new therapeutic interventions targeting concussion. And you have a large group of individuals that are looking at concussion using different types of new therapeutic interventions. And one of the things that you're most excited about is the cannabinoids and actually utilizing them to actually treat patients with concussions. So can you tell us about that program and what the goals of it are and who you're actually collaborating with internationally on this program?
Sure, and you and Helen and Dr. Michael Hoffer and Bonnie Levin, we've got a super neuroscience team that we've been working on with, the last 4 years in the lab. But I think, that lab data that we've been, sort of blessed to have, even through these times, has really pointed us into the direction that we may be ready eventually to look at CBD, cannabidiol, with mild brain injury in real patients in the clinical. So there's a lot of good work that's been done by experts in Israel and all over the world looking at the endocannabinoid system and the effects of this system on pain, headache, anxiety. And so we know that with these receptors that they've sort of pointed out and focused on in the brain, we think there's an opportunity here to look at just CBD without the THC, how this could be effective. And so our team, here at the University of Miami is very, very excited with working with a company in Israel that is able to now be able to send us their CBD product and even make a pill or a capsule down the road that we would like to give to patients.
Mm-hmm. Yeah, this could be a game changer in terms of a new treatment for concussion. And I think it's such an exciting area because the international flavor of people working together, and I think that's something else that we're trying to do more and more at the university and the Department of Neurological Surgery in the project is actually to reach out to experts all over the world to actually utilize their new drugs, their new hypotheses to actually move new treatments forward. You mentioned Dr. Michael Hoffer. That's exciting because a lot of that work is targeting civilians, but his work with the blast injury models and things like that target military personnel that are also be injured by bombs and blast injuries and things of this nature.
And we know, those are like the, I guess, lion's share of a lot of brain injury that we do see, unfortunately, in war and, during those times. And we know that there are definitely these soldiers coming back with different kinds of injury, whether it is from a bomb going off or a car accident where they hit their head or just a trip and a fall, or even, when they go out and play sports, we see like the whole severity and spectrum of injury. And we're not good at treatment yet, Dalton. I think like we have to take a hard look. And I've been in the brain injury world, as you have, for very, very many years now. And, we've got to get further on treatment and really evidence-based treatment of how we can improve people's lives.
Said. Well, thank you, Gillian, for talking with us today. Greatly appreciate everything you and your programs are working on and the progress you're making. Congratulations. And we'll have you back to hear more about your programs in the near future.
Okay, stay safe. Thanks for the opportunity.
Thank you. Have a great day.
Okay, bye-bye.